Doctors and nurses of Reddit. What's the most blatant lie a patient has told you about why they're in the hospital? I'm a paramedic. And it's the ones who deny doing drugs and insist we don't know our job. I had one patient swearing up and down he doesn't do any drugs. He was just sleeping on the kitchen floor while cooking. Do you know why your mum is crying? She just did CPR on you because you stopped breathing. Then admitted to doing some weed, and crack, and heroin, and meth. ETA this was after he woke up to naloxone. I always ask twice if drugs are suspected before moving on to other medical issues. I'm an addiction medicine specialist. The patients I treat are detoxing from various substances. The interesting thing is that most of the patients I see are hyper-honest. They've been lying to everyone about everything for years. And when they get to me, the floodgates of truth open up. They are so excited to tell the truth to someone. They just let it rip. But there are some exceptions. Some are so used to lying that they do it reflexively. I have had a few alcoholics show up completely wasted and insist they didn't have anything to drink since yesterday or something. This is particularly funny because we literally tell them on the screening call to show up to treatment drunk. We don't want them to stop drinking before they are in our care because untreated alcohol withdrawal is so dangerous. For opioid detox treatment, I generally use a rapid Suboxone taper. Suboxone is an interesting medication. It's highly effective at managing withdrawal once it's started. But if you give it before withdrawal has started, it will start it for you in a violent way. We call it precipitated withdrawal, and it's like going from mostly comfortable to abject physical hell in minutes. It can complicate the process a whole lot. So obviously we try to avoid it. We assess patients and avoid administering Suboxone until moderate withdrawal has started. This assessment starts with the simple question, when was the last time you used? Quote, occasionally, I'll have a patient who appears completely comfortable, zero withdrawal, trying to tell me it's been several days since they used. If that's the case, they're either lying or don't need to be in my care. Either way, when I explain the risk of early administration, they usually come clean and say, okay, I used in the parking lot before I came in. The other one I see is people severely understating the amount they drink. Mostly because they're embarrassed by it and they think that their disease is uniquely horrifying. They usually open up when I tell them, no matter how much or what you drink. I've seen worse. I've only been wrong about that a couple of times. And honestly I think it'll be a while before I'm wrong again. The last time I saw a worst case, they had such an amazing level of consumption that I legitimately wanted to study their body and figure out how they were alive. This person was 50, didn't look a day under 80. I have no idea how they made it to 50. Not the most obvious lie, but the first that springs to mind. An extremely overweight gentleman attended complaining of abdominal pain. It transpired the likely cause was a 32 cm hammer, head plus shaft, sitting within his colon. He stated that whilst engaging in inebriated amorous activities with a woman, this had been inserted without his knowledge. The name, whereabouts and contact details of this woman was unfortunately unknown to him. So I could not corroborate his story. I have my doubts. I had a frustrating itch inside my rectum and the carrot was the only object that I could fit in there. I work in the emergency room and the excuse train comes in close to holidays, weekends and expected nice days. Usually we can tell that they just want a doctor's note to get out of work. Massive migraine. Stomach hurts. Major neck pain. Chest pains. Plain old not feeling well with vague symptoms. Then after we write the excuse. Discharge them. They walk out as if they were walking on sunshine. Disclaimer. I do wish companies gave more room for mental health days or the I'm taking the day off. A 14-year-old patient claimed he accidentally swallowed a small fork while eating pickles. X-ray revealed the fork was a full-sized dinner utensil in his colon. Had him tell the story again. And he insisted he swallowed it until it was explained that was impossible and he admitted what really happened. Poor guy. Not a medical professional. Just happened to be in the hospital and got the pleasure of witnessing. Man was on stretcher handcuffed to it with multiple police, border patrol etc. surrounding him on a Sunday morning about 8 a.m. The whole time he was screaming, "I work a 9 to 5. This is police brutality. I work a 9 to 5. Police brutality." He had run the border while on and carrying benzos. Narcotic prescriptions, pills. Lost. Stolen. Eaten by dog. Flushed down toilet accidentally. Pharmacy miscounted etc. No one ever loses their thyroid pills. We really need to make anal sex toys less of a taboo thing. Just buy a toy online. People. You won't end up on these posts. My friend told me a story about a woman that fell into hypothermia due to suicide attempt by jumping into a river during winter. When she was asked what she was doing, she said, "I was just taking a walk when oh no. I suddenly slipped and fell into the river, so I decided to take a swim for 30 minutes and that's when police found me. I didn't OD, I was only drinking." Easy. A guy came in complaining of being constipated and couldn't poop for 5 days. He reported rectal blood and difficulty passing gas. A CT was done and showed a 9-inch linear object bordering or slightly puncturing through his bowel, with questionable free air. With the court results in hand, we confronted the guy. 9 months ago. Yep. 9 months ago this guy got out of prison where he stuck a prison shank in his butt to hide it during a cell search. It was already in there about a year before he got out. He didn't tell anyone for fear of adding on his prison sentence. He was never able to retrieve it and thought it would just pass naturally. He was just hoping we'd give him some prescription strength laxatives and he'd have better luck. He needed surgery. Tell your doctor everything and the police nothing. I've told this story many times before. But when I worked in the emergency department, there was a frequent flyer who would come in complaining of migraines, seizures and stroke symptoms. She was completely full of shit. Just wanted drugs and attention. One time the symptom she presented with was that she could only speak Spanish. But the thing was that in reality she couldn't speak Spanish ***, so you had to ask her yes or no questions or she just wouldn't respond. If the answer was yes, she would say sí, and if the answer was no, she would shake her head. Because she didn't know the Spanish word for no is no. Was in the hospital for kidney stones. Heard this through the curtain in the How did you get those marks on your arms? Quote, poison ivy. Are you an IV drug user? These marks all line up with veins. No. Poison ivy occurs in patches. I have poison ivy. I need benzos. We don't give benzo for poison ivy. Let's go home. To whoever was with her. You have a very serious infection. We need to assess. Are you sure you haven't been sharing needles? Quote, I'm sure. I have to leave. Okay. We need to prepare to discharge. I was sharing a needle with a friend. Had a patient convince his wife he got an STD from a dirty toilet seat in the ER when he arrived to the hospital. He was in-house for about a week or two after. His wife dutifully staying with him each day until about 6. She home-cooked meals for him every night and would bring them to the hospital each day while trying to file complaints to us for his STD he got from us. A doctor had to kindly explain to her the impossibility of him getting that particular STD from a toilet seat and it also become active, symptomatic in that time frame. She never believed us. After she went home each evening at 6 to cook for him for the following day. His affair partner would show up from 7 to 10 each evening. I've had patients claim to be suicidal in order to be admitted because they were literally hiding from the police. Back when Viagra first dropped, every grandpa in Miami with chest pain would lie about why they had a raging erection. Or the boner would be gone. And they'd be so much more confident in their answer. No matter how much we stressed how unsafe lying would be. No matter whether we ferried the ladies out of the room. It was quite a way for little baby nurse me to learn how low blood pressure could get. Being in Miami at the time was like being on the front of a boomer battlefield for erectile rights. I fell on it and it got stuck. Unless you have video of it happening, no medical professional is going to believe that. Not a doctor. I have worked in mental health facilities, a lot of paranoid persecution beliefs. No, Steve. Name changed. You are not here because you know government secrets. You stabbed someone while you were on meth.